Clinical signs: due to bleeding inside the myometrium. Adenomyosis shows following signs: severe dysmenorrhea, pain during menses, heavy menstrual bleeding, enlarged uterus. Diagnosis: most definitive diagnosis of adenomyosis is by histopathological examination of uterine sample, under microscope, but it can only be obtained by hysterectomy. Other methods of diagnosis are ultrasound, MRI, investigation of choice. Number 1. Ultrasound examination. It shows adenomyosis if it is localized. It can show blood-filled, hemorrhagic, distended endometrial glands in the myometrium, irregular and nodular appearance of uterus. Number 2. MRI investigation. It is the investigation of choice. It provides excellent identification of myometrium and endometrium separately. It shows adenomyosis within myometrium as separate ectopic endometrium islands. There are two types of treatment options: medical treatment, temporary; surgical treatment, permanent. Medical treatment: it is only a temporary treatment. It provides symptomatic relief only, since endometrial tissue of adenomyosis responds to estrogen. So any treatment that induces amenorrhea, pseudomenopause, will provide relief. But once the drugs are stopped, disease will occur again. Following drugs can induce temporary menopause: progestins, gonadotropin-releasing hormone agonists. Number 2. Surgical treatment. Hysterectomy, surgical removal of uterus, is the definitive treatment.